Hello, everybody. Good afternoon. Thank you for joining us once again on our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. James Bridger, our Acting Health Officer, as well as Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, and Sean O'Donnell from the Department of Health and Human Services. We do have an additional special guest today, Ilana Branda with the Department of Housing and Community Affairs. Good afternoon, everyone. And with that, to you, Mr. County Executive.
So thank you all for joining us again this week for our weekly briefing. We'll start with our COVID rates. Our test positivity rate is currently 1.44%, and our case rate is 32 cases per 100,000 residents. And our hospitalization rate is down to 3.2% of inpatient beds occupied by COVID-19 patients, with only 3 admissions per 100,000 people over the past 7 days. This is good news. Nationally, our hospitalization rates are the lowest they've been since last summer. And just last week, we had no patients in our ICU units for a period of 48 hours. This is all very good news for our community. I continue to remain concerned, and like everybody else, we're looking at seeing the first cases now of the BA.2 variant. We know that in several European countries in Asia, the BA.2 variant is spreading and spiking cases. You can see this chart of cases in Europe, and you can see all the countries listed there pretty much have started an upward jump from a decline around the beginning of March, and now their lines are beginning to creep up again with dealing with the new variant. And as we've seen numerous times over the past 2 years, an uptick in Europe often precedes an uptick in the United States. If another potential surge does happen, it'll be in a nation and state that's certainly not in the same place as we were just a month ago. In a recent Axios poll, 64% of the survey respondents now favor the lifting of federal, state, and local government COVID restrictions, and that's up 20 percentage points since early February. The good news from this poll is that 3 out of 4 surveyed say they would go back to masking if infections increase again where they live. So that's probably the key statistic. It's okay to lighten up, but at some point, if this comes back, we need to do the things we know that actually work in order to keep those numbers from reaching proportions that would be difficult to manage and cause a lot more pain than's necessary. This week, Goucher College released a poll of Marylanders, and 44% viewed the pace of lifting masks as about right. 28% said we were moving too quickly, and 25% responded they were moving too slowly. The number in that poll that said, the number that came from Montgomery County and Prince George's County said that we're moving too quickly was 37%. It was 9% higher than the state average. And I appreciate the higher level of caution that many local residents put on how we should be handling COVID. Also respondents to this poll who are concerned about getting COVID or having a close family member contract COVID is about 53% as opposed to 71% a year ago. The very good news from the Goucher poll, and I think it's important to note, is that local health departments of Montgomery County and Prince George's County received a 75% approval rating, which is higher than the governor's approval rating. And I want to congratulate and thank our HHS departments for this acknowledgement of a job well done. Another concern is that our vaccines' efficacies are waning and our booster rates continue to stagnate. In Montgomery County, about 52.8% of our residents have received their booster or additional dose. We're now down to delivering 3,000 boosters a week. This is only 10% of the peak of our booster efforts that occurred later in the year. As you can see from the chart below, boosters are so important to preventing severe illness and death. When you look at the results from the Omicron surge, there was a 5 times greater chance that a fully vaccinated person would perish as compared to those who were boosted. This is really important. We're at the point, and I've said this before, that really no one should be dying of COVID. We've got vaccines that can keep you from getting infected. If you do get infected, they're incredibly preventive and effective against death, which is probably the thing we're most all concerned about. So it's critical that people wrap their head around the need to go through and get their vaccinations, their boosters, if they haven't gotten the boosters. And obviously, if you're not vaccinated, it's never too late to get vaccinated, mostly. And if you haven't been vaccinated yet, you should consider getting vaccinated. There's certainly a likelihood that we're going to see other variants and other surges in the coming months. Would not be unusual. And those who aren't vaccinated are always going to be most at risk, and certainly most at risk from being severely impacted by it. So please think about your health, think about your friends, and get vaccinated. Demographically, we continue to struggle with our younger and middle-aged adults, as well as Latino and Black residents getting boosted. Our white and Asian booster rates for 12 to 64 are nearly double the rates for Latinos and African Americans. We continue our marketing and outreach efforts to promote boosters throughout our communities, and specifically to our Latino and African American communities. Here on the screen is an example of a recent ad featuring our award-winning COVID spokes grandmother, Abuelina, promoting vaccinations and boosters. Finally, I'm disappointed, but not at all surprised, that Republicans in Congress are trying to cut $7 billion in funding from President Biden's $22 billion request for additional COVID funds. It's one thing to not believe in science, the efficacy of the vaccine and masking, or that this virus is not a risk to anyone's health, but to cut funding at this point, when we're not clearly out of the woods yet, is ridiculous. Congress has a job to do. You ought to be helping keep people safe. And you should be proud of being part of a government that's doing everything they can do to keep people safe, rather than playing nickel and dime with this and cutting the government's ability to provide resources to communities around the country that are still dealing with and will be dealing with COVID as we go forward. We rolled out our budget yesterday, and I announced that this budget includes historic levels of funding toward education, affordable housing, public safety, and our efforts to combat climate change. I will say the dire economic predictions for our region because of the COVID pandemic did not come to fruition due to the impact of state and federal aid and the underlying strength of the local economy. Our COVID-related expenditures focus on addressing the learning loss of our students, assisting our economic recovery, as well as increasing our food resiliency, mental health supports, and our efforts toward equity. To combat the learning loss of our students, my recommended budget provides enough resources for 100% of student needs. In addition to funding provided directly to MCPS, this budget contains significant funding to support the mission of our school system and ensuring that children have access to healthcare and mental health services in our school. In the DHHS budget, Department of Health and Human Services, I'm recommending over $920,000 to open the new Kennedy Wellness Center, Kennedy High School, 2 new health room positions at new elementary schools, Gaithersburg Elementary. And in addition, this budget funds 6 full-time school health nurse positions. These positions will fulfill the county's requirement to ensure each high school, middle school, and large elementary school have a school health nurse, and that there's 1 nurse per 3 smaller elementary schools. I'm also recommending $830,000 to fund converting a 10-month school health staff to year-round employees to support students in summer school programs. And I'm providing funds to support a 2-person school health staff training team. My administration is exploring options to expand high school wellness centers to those high schools that do not currently offer the service. As an interim step, we're recommending $3.7 million to fund enhanced mental health supports in 10 of our high schools with the highest needs that do not have a high school wellness center, and it provides additional mental health services at 6 high schools with existing high school wellness centers. My budget also helps our economic recovery. We have $1.2 million in there for the Montgomery County Economic Development Corporation. to increase their activities. It's a 24% increase and make certain that we can further market the county as a top location for specialized industries such as biotech and hospitality, as well as recruit and retain new and growing businesses through the year. Our hospitality and restaurant industries were especially hard hit by the pandemic. I think we all know this. Our budget contains funding to support operations of the Conference and Visitors Bureau at its pre-pandemic level and to compensate for the lagging hotel revenues that funded that group. Moreover, my budget has $500,000 to support destination management to encourage and attract visitors to the county. And to help address our most vulnerable low-income residents, my budget contains about $2 million to provide additional 120 rapid rehousing slots to address homelessness. We'll add, we celebrated, I guess, 2 weeks ago, the opening of our 200-bed shelter on Neville Street in Rockville, which is an incredible step forward and ended the county's policy of having people sleep outdoors most of the year. In addition, we're also providing $3 million in new funding for our rental relief assistance program to increase the maximum subsidy available to families up to $400 a month, and to include more families in that increase. The budget also provides $700,000 to fund homeless diversion hotline and centralized shelter intake for households without children, and provides $180,000 to increase street outreach resources in Silver Spring and Wheaton. We are putting more teams on the ground in those two jurisdictions. They have large amounts of homelessness, and we're trying to make sure we have resources who can work with homeless people while they're on the street there. Hopefully more of them will wind up in the shelter in Neville Street, but we want to make sure we can provide the mental health resources that they need. To deal with many of our residents who are experiencing food insecurity, and this is a large number, and the people who provide this have told us that their numbers are actually still quite high. This budget includes creating an Office of Food System Resilience in the community and inside the community engagement cluster. And it's going to be staffed by a director and a policy analyst and a food system partner specialist to coordinate the food resilience efforts within our community partners, government agencies, and our regional partners. And I'm also including $4 million in the budget to allow the county to continue to provide food directly to those who are most in need. And we're going to continue to evaluate the continuing needs for food throughout FY 2023. And if we need to recommend additional funding to do so, we will recommend additional funding. One of the most valuable actions we took during the pandemic was partnering with local organizations throughout the county to serve as service coordination hubs to make sure we reach as many people as possible. And this budget provides $5.6 million in general funds and ARPA funds to continue our support for these hubs. And to address the mental health challenges due to COVID, the budget recommends $1 million to Health and Human Services to support transition to a 988 call center in our community. In 2020, Congress designated 988 as the 3-digit dialing code to connect distressed residents with suicide prevention and mental health crisis services. Furthermore, I'm including $800,000 to address increased call volume at Every Mind, which is the county's mental health hotline. And as I mentioned yesterday, the recommended budget, just like our COVID response efforts, was created through an equity lens. And we've seen all too clearly the pandemic has laid bare the health disparities that existed before COVID hit and persisted throughout COVID. And to that end, we are adding about $6.3 million combined for the African American Health Program, the Latino Health Initiative, and the Asian American Health Initiative in DHHS. Having these community groups doing work in the community proved to be more effective than simply doing traditional government outreach. And they've been able to connect with more people and to get deeper in the community, and we intend to keep this relationship going forward. My budget also adds $877,000 to better address disparities in the Black business community and to provide increased training and resources. And this allocation includes a $750,000 grant to the Black Chamber of Commerce and $127,000 to the Black Business Council. Economic development news is actually pretty good. Last week, Stonebridge Development announced that they were constructing another 800,000 square feet in lab space in our county, including 250,000 square feet in Gaithersburg and over 550,000 square feet in North Bethesda, White Flint. And this development is further evidence of the county's strength in life sciences, and it actually brings the number of, or the amount of square feet under development for lab space up from 3 million about a month ago to 4 million now. So we're seeing and continue to see rapid growth in this sector. And if that wasn't enough, just yesterday, California-based Miltenyi Biotech announced that they were moving their headquarters to Montgomery County. Together with the move, they plan to add another 130 jobs to their already existing facility in Gaithersburg, and they're focused on advancing biomedical research and supporting cell and gene therapy, and they already know Montgomery County. So we welcome them bringing their headquarters to Montgomery County. Look forward to working with them and to watching them grow here. The talk of the town continues to be high gas prices and the impact that it's having on families' bottom lines. As I mentioned last week, for those feeling the pinch of these prices, we want to let you know that we're having our first Go Electric event. It's going to take place this Saturday, March 19th, from 10 a.m. to 4 p.m. The event is going to showcase future electric power, from electric vehicles to power equipment and solar power. The event will take place at Montgomery College in Rockville. It's a free event that will display and have experts explaining the benefits of electric cars, battery-powered yard equipment, solar power, small appliance recycling, and energy incentives. And one of the energy incentives included in our budget, by the way, will be incentives to encourage people to move from gas-powered leaf blowers to electric leaf blowers. It's less polluting, it's more healthful, not breathing the fumes from a gas-powered leaf blower, and maybe most importantly, your neighbors will like you better when you're out there doing your lawn. I also want to thank the County Council for the unanimous vote in favor of the CPACE amendments. The CPACE stands for Commercial Property Assessed Clean Energy, and I was really pleased to send this bill over to the council because it's an opportunity for all building owners in the county to finance improvements to their buildings and make energy solutions more accessible. These flexible financing tools offered by the county's Green Bank give private property owners the opportunity to make their buildings more climate resilient and energy efficient, thus improving operating costs and reducing greenhouse gas emissions. And finally, on the climate change front, I just want to express my disappointment regarding Sarah Bloom Raskin withdrawing from consideration to be a nominee for the Federal Reserve Board of Governors. President Biden nominated her in January for the position of Vice Chair of Supervision at the Fed, a role that would have made her a powerful regulator in the banking world. But she faced stiff opposition in the Senate based on her stance on climate change and the fear that she could discourage banks from lending to fossil fuel companies. We need to discourage banks from lending to fossil fuel companies. It's a shame that in 2022, an incredibly talented leader such as Sarah Bloom Raskin is being blackballed from serving in this nation over believing in science and common sense. It would have been great for her, this country, and our nation if she would have been able to serve in this role. It is really lamentable that the Republicans in Congress still function in denial about so many things. And it turns out that climate change is just one of several things that the Republican Party cannot wrap their hands around. Second anniversary of COVID. This is going to be Housing Week. Throughout this month, we've been recognizing the second anniversary of our COVID response. The first week of this month, we recognized residents that we lost. Last week, we honored public health workers and institutions. This week, we're focusing on our housing efforts over the past 2 years. And Alana Brand, who is our deputy chief of the department, is joining us today. And she's been our point person on our rental relief efforts, which has been and continues to be a significant undertaking. And with that, I'll turn this over to Sean O'Donnell, Dr. Bridges, Dr. Stoddard for their updates, and then we'll return to Alana to provide us a housing update. Thank you.
Thank you very much, Mr. County Executive. And I appreciate that our county executive has touched upon a number of the most recent data points that we're looking at, and I'll try to spare you repetition here. Just wanted to add in that while we're seeing a decreased number of cases, decreased hospitalizations, the numbers that the county executive shared with you is a similar metrics that the CDC is using for tracking hospitalization numbers, which does include, we believe, a slightly larger area than just Montgomery County. We are seeing, again, just in Montgomery County, down to almost 1.9% of hospital beds with our COVID patients. And again, very small numbers, both in acute care and ICU. We're very happy to see these numbers come down and even have that point for a day or two where we had no patients in the ICU. We're still, of course, tracking deaths. Those have come down in March too. The rates of COVID-related deaths, fortunately, have come down as the cases have come down, but we'll continue to track those at both the local and state level. As we've mentioned, the vaccinations, in particular, the additional doses or booster doses have slowed down. We are at 56% of those fully vaccinated 12 and older who have received a booster dose or additional dose. Those are not separated in the tracking, whether those individuals who were immunocompromised and got an additional dose that's not counted as a booster. Those aren't really separated in any way that we can split those out, but it is a smaller number of the total. So they're grouped together as 56% of those 12 and older. Again, we do see a disparity in the populations within Montgomery County who've come out for booster doses, and we're working with our health initiative partners and other community members to try to increase those booster rates across all of our populations. As you can see from the top chart, our testing has decreased quite significantly since the heights around the holiday travel and the holiday gatherings, which again coincided with the heights of the Omicron phase. And you can also see the vaccination levels have decreased. We bring this up because you can see that they were very low in the past as well, and we were able to surge those resources both from our public sector resources as well as our private sector partners. This is just showing the public sector coordinated testing and vaccinations. And we want to make sure that if the need arises again in the future, that we can again surge to these levels. And again, it will be a partnership with our private sector partners. To that end, the distribution of rapid tests give us some flexibility with testing where individuals have these tests already at home. And if they begin to feel symptoms, or if they have a family member or a friend notify them that they should be tested, they have the ability to do this testing on their own with the rapid test. We continue to distribute those out through all of our libraries in the county during available library hours. A new initiative that is beginning today. There was a press release yesterday with additional details, but just wanted to share that beginning at 6 locations today, you can pick up self-tested PCR tests and drop them off at those locations as well. Again, you can take the test kit home, and when you need to complete it, you can test yourself. It's a very, very similar process to the rapid test, except it gives you the additional information that a lab confirmed PCR test would give you. And as you can see from the presentation, we've labeled drop boxes, secure drop boxes at each of these sites. 5 of them are our community recreation centers, and we also have one at the Dennis Avenue Health Center. That's all the updates from the Pulse report we have for today. Again, it's largely good news on those fronts as to what we're seeing in the community. I'd now like to ask Dr. Stoddard or Dr. Bridgers if they have additional comments they would like to share.
Thank you, Mr. O'Donnell. I have no additional update. Happy to join the county executive this afternoon to respond to any questions. I'll turn it over to Dr. Stoddard now.
I also don't have any additional opening comments. I think we're going to turn it over to Ms. Branda, who I believe is at Health and Human Services, not Department of Housing and Community Affairs. Just wanted to make that point.
Yeah, thank you. Yes, Alana Branda, the Deputy Chief for Services to End and Prevent Homelessness at HHS. We work very closely with our partners at DHCA, with our Department of Housing and Community Affairs on all these housing initiatives. I just wanted to highlight a couple of items in our housing week. So first off, as the county executive mentioned, a lot of our focus over the past 2 years has been providing specific rent relief assistance to households that have been financially impacted by COVID. And so as of Monday, we have released over just under $74 million. As of today, we're there in rent relief to over 10,000 households to help keep them in their homes and prevent evictions. We started releasing those funds back in May of 2020. We were one of the first jurisdictions to identify funds and acknowledgement of this impact that COVID is having, and to make sure that people could remain in their homes. We also know that housing really is healthcare, right? Our mental, our physical health is severely impacted when we don't have stable housing. And it's important to recognize that over these past 2 years, our homeless continuum has helped over 2,200 individuals move into their own permanent housing. And that is, 2,200 individuals now have keys to their own home, a safe place to stay and be during this pandemic period. It's also very exciting to be able to share with you that yesterday HUD released their decisions on the continuum of care competition that provides funding for homeless services and housing throughout the whole country. Montgomery County is receiving over $10 million in assistance. This is a $1.4 million increase in our previous year's allocation. And we are also very excited to share that we will have 2 new housing projects that are being funded by HUD that will be opening up in our community. One is specifically a rapid rehousing program to serve survivors of domestic violence. And the second project is a permanent supportive housing project to serve those with high risk and severe medical conditions, both somatic and psychiatric medical conditions. We have also been able over the past 2 years to provide over 22,000 grants related to home energy assistance for households in the county. So this is assistance with electric and heating bills to, again, help ensure that these households who have been impacted by COVID or who have lower incomes in the county are able to remain safely in their homes. The county executive also highlighted many components of his FY23 budget, and I would just also note that there is over 140 million dedicated to housing related services. This includes over 42 million for existing capital projects, 40 million for a naturally occurring affordable housing capital fund project, and 57 million that goes into the Montgomery Housing Initiative budget that is used both for existing facilities, loans, capital, and also for many of our supportive housing programs. And so with that, I will turn it back, and of course, here to answer any questions.
Thank you, Ms. Branda. And thank you, Dr. Stoddard, for making that correction. I did realize that I made a mistake at the beginning introducing her. And with that, let's open for the Q&A portion of the presentation. I believe Rebecca Tan with the Washington Post has some questions. Good afternoon, Rebecca.
Good afternoon. Thank you for having me. I have 2 questions. The first one for the county exec. You mentioned in your budget that you're allocating more money for mental health services. We've seen with like MCPS that even when there is new funding for social workers and counseling staff, there might not be the workforce available to fill those roles. I'm curious to know, how is the county going to ensure that it's actually going to be able to fill those roles that are included in your budget, these new roles? Oh, I think you're muted.
So Rebecca, if I don't put them in the budget, there is zero chance that I'll fill those positions. If I put this in the budget, we will be authorized and go about trying to fill these positions. We are, though, evaluating the pay scales. That was one of the issues that came up, and we will make adjustments to the pay scale accordingly to make sure that we can be competitive and bring social workers here to the county. So this will be part of an effort that's more than just putting a budget line in, but actually trying to address why we're having trouble attracting them. And hopefully we'll do better. There are going to be, another slew of people graduate in June, and hopefully we'll be at their doors saying, come to Montgomery County. Pay is good, benefits are good, and we need you.
Got it. And my next question, also for the county exec, but for anyone else who has the answer, does the county have a sense of how many residents are living with long COVID? And is there any county government support that's available for them?
Sure. Thanks, Rebecca, for your question. We don't have the data. The state has been tracking that data and hasn't been provided to the local levels yet. I do know that from my discussions with the county health officers and with the Maryland Department of Health, there will be an acute care service center in Laurel in Prince George's County at the end of April to address some of the needs of long care for COVID or individuals who have contracted the coronavirus, but that's still pretty much in a planning phase. And so as the data come in, we will share the data with the media and the public accordingly. But right now it's in the planning phases, so we don't have that information readily available.
But also, as part of the county executive's budget, they're continuing funding for the health initiatives, which obviously will be an important support for people who not just have long COVID, but have other conditions moving forward. That's an expansion of services that began during COVID-19 and would obviously continue to serve those who suffer long COVID or other illnesses in addition. So obviously, we're going to have increased resources in this budget to help address some of those long COVID concerns, among other health concerns.
Thanks, appreciate it.
Thank you, Rebecca. Next question coming from Steve Bonnell, Bethesda Beat. Good afternoon, Steve.
Good afternoon. This first round of questions, I think Alana is going to be best fielded to answer. There have been many rounds kind of the emergency rental assistance money. I think there's another set pool of federal money that is yet to be kind of allocated, and you all are kind of working on a program. And I'll start, what's the update there? I think I heard yesterday too, I forget, it was at the council, that the county's dipping into some of that pool of funding to deal with the current round of funding. That's kind of a multi-pronged question, but I'll start there.
Sure. So yeah, as you identified, there was 2 rounds of emergency rental assistance funds made available from the Treasury. As a entitlement jurisdiction, we were eligible for a direct allocation from Treasury, and then the state of Maryland also received allocations. Our round, what we called our COVID rent relief round 3, round 1 and 2 were funded with local and CRF dollars. So in the round 3, we identified using our emergency rental assistance round 1 funds to pay for that round. That is the applications that closed on December 31st, 2021. We still have some of those applications to finish processing. We did make a commitment that any application received prior to that December 31st deadline would be funded if found eligible. And so what we are identifying at this point is that we have exhausted both in direct assistance and in staffing obligations, all of our ERA1 funds that we have received both through our direct allocation and through the state of Maryland. And so yes, we have started using ERA1 funds to finish paying and providing those rent relief grants to households that had applied before that December 31st deadline. That ERA2 funding, we did receive a direct allocation from Treasury of $34 million. That has been appropriated by the council, so we are able to start dipping into that. And the state announced allocations that they would be providing a couple of months ago, and or actually I think it was just last month, and they are providing us $6.4 million of their ERA2 funds. We are still working through the technical logistical side of having that funds available and appropriated to the county. So we will have those funds. And then, as you noted, we will open up an additional round of assistance to make sure that we are releasing all funds available to residents in the county.
I guess I'll ask though, of this current round of funding that you're dipping into to fulfill applications from the period that just closed, do you know roughly how much money you're going to need to dip into, if that makes sense?
Yeah, we're estimating that it might be anywhere from 10 to 15 million. The grants range in pricing, and we have been seeing more applications that they're coming in at the lower end of the assistance needing, which is in many ways a good thing. So that's why the range is a little broad. But we do expect that it would be somewhere in the 10 to 15 million range.
When you say lower end, how much, I guess, is being requested per applicant?
Yeah, so our average grants had ranged between about 10 to 12,000 previously. We're seeing that number dip a little bit closer to 8,000.
Is that I mean, I'm sure you're glad to see that. Do you think that's a trend that's hopefully going to be continuing, or is it tough to say?
It's definitely tough to say. I mean, we still definitely see individuals who have not been able to return to work for various reasons, who maybe there was also a death of a wage earner, and that household's composition and their financial status is, permanently changed. And there's going to be still that tremendous need in those households. We are fortunately seeing many more people that are starting to be able to return to employment, whether it was the employment they had before or have been able to identify new employment. And so some of what we're seeing now is really helping people catch up where they had insurmountable rental debt that they had accumulated, but they're in a better position to stabilize and maintain their rent payments moving forward.
One of the things, this goes back weeks to a council meeting when you all were kind of going back and forth with the state about kind of the latest allocation coming from the state. And when I reached out to the state last month, they kind of said that if you take the kind of the whole piece of the pie, that the county has gotten, the money that is proportional given how much federal money came in this latest round. I just want to give you a chance to respond to that. I'm sure you've heard that argument, but I wanted to hear from you, I guess, about that perspective.
Okay. Before I answer that, I just want to defer to the county executive. I don't know if you want to take that at all, or if you want me to keep going.
Well,
Okay.
I'll say you probably know the numbers better. My recollection was that it was not proportionate to our share of the state take.
Yeah, so as the county executive said, I think we have asked for transparency in the calculations that they use to identify that proportion based on information that we understood that they were using to determine their allocations, and what we can verify with our census data. We do feel that the need in Montgomery County warranted additional funding.
That's based off the high rents, kind of the high demand compared. Can you just get into a little bit of, a lot of people say, well, you've gotten the money per population, but I think what you're trying to say is that we have more need, just dire need here. Am I on the right track there? Or?
Yeah, we have the highest number of renters by jurisdiction. The highest number of high need low income renters are in Montgomery County. The highest number of renters who are severely cost burdened and are paying more than 30-50% of their income towards rent are in Montgomery County. And our rent cost is by far higher than any other jurisdiction's rent cost across the county. So from those perspectives, we do feel that we were hoping that the state would be looking closely at some of those numbers and calculations in order to divide up the funding that they have received.
And Alana, you can correct me if I'm wrong, but haven't we also seen a significant greater portion of the applications themselves already in earlier rounds?
Yeah, I mean, one of the challenges, I guess, is that we did receive over 14,000 applications for the current round. We our program was only eligible for households making 50% of AMI or below, because we knew that even within that, the need in the county far exceeds the available funding that we have. And so one of the other things that our understanding is the state looked at is the proportion of applications you received compared to what you were able to fund. For us, unfortunately, at this point, many of our companion jurisdictions had a program that had broader eligibility to it. And so we may not have received the same number of applications because we, identified from the beginning the high need in the community.
And sorry, Alana, hopefully this is the last question. You're getting your money's worth today. I remember kind of discussing when this ERAP 2 funding, the next round will be announced. Sorry if you already got into this, but do you know roughly when you might determine when to open up another round of applications and whatnot?
Yeah, unfortunately, I don't have a concrete answer for you. I know that's the question that everyone is asking. We needed to make some substantial software changes. And we are unfortunately experiencing some delays that we were not expecting with some of those changes. And so I know as soon as we have the software close enough that we know when we will be able to open everything back up, we will, of course, share that with everyone.
Thanks so much, Lana. The last question I actually have is for the county executive. I know Rebecca kind of touched on this already, but you've kind of beaten the drum about long COVID and kind of the impacts that has had for people in the community.
Right.
Obviously, you had COVID around New Year's, and I know you talked about this a little bit already about what you personally have gone through. Any update there? I know you were kind of talking about what you've been discussing with your doctor. If you want to share.
Yeah, I still have this this thing in my throat that causes me to constantly have to clear my throat because I'm getting a mucus buildup. But I mean, the good news, it's neither in my sinuses nor in my chest. So as long as it stays in my throat, I worry less about it.
And obviously, because you're boosted, you think that's why it's not worse, I imagine.
Well, I think being boosted probably kept me from getting a worse version of this thing than I otherwise would have. So I feel like it was definitely the right decision to make.
Thank you, everyone, for my long line of questions today.
Thank you, Steve. I do not see that we have any other questions from the members of the media. Going once, going twice. I guess we're done for today. Thank you, everybody, for joining us. Good afternoon. Stay safe. We'll see you again next time. Bye-bye.
Bye.